So this question is from Sam. Sam is interested in guided imagery for an anticipated procedure he's having that you have to stay awake for. So this is guided imagery that addresses the yucky medical procedure, basically. The thing you gotta do that you fear and loathe, that you keep stalling on making the appointment or postponing it or rescheduling it because you just don't want to do it. So this could, all kinds of yucky things qualify for this situation, and we all know them well. So Sam wanted to know, do you have to listen to this during the procedure, or will listening to it beforehand be sufficient? So to Sam, we respond. People usually prefer to listen to it during the procedure as well as before the procedure. And when you do listen to it during, after having listened to it earlier many times or a few times, it probably really does serve as a good anchor that connects you to the cumulative impact of all those previous listenings and kind of coheres the experience of self-calming in a super powerful way. We do get great results from this, and it is very effective. But so probably before plus during is your sort of ace in the hole best way to do this if you needed to have a best way. However, that said, people who hear the imagery for the very first time during the procedure do surprisingly well. And those who don't use it during the procedure, either because they don't want to, or they forgot to bring the stuff, or because it's not allowed by the staff, but if they heard it before, they still benefit from the previous times listening, do really well. So there's no exact perfect way you have to do this. Pretty much any way is going to help you, which is nice. The other thing you should know is studies show that an average of listening just 2.5 times before the procedure gets significant positive results. Reductions in anxiety, reductions in recovery time, and uncomplicated comfort. And the other thing you should know is some people use it a lot more than that, even though they don't need to for the results of the procedure. But they listen to it a lot because it helps a lot with anticipatory anxiety, which is the main reason why people use this thing in the first place, this guided imagery. It is a great binder and reducer of anxiety. So if you're getting those fear and loathing feelings and you want to call and postpone this procedure again, just listen to your imagery and you can get through this and be done with it. The other interesting finding that we know that we were not expecting at all, and it's been replicated, so it's not just once, is the more anxious a person is at the outset, the more dramatically they will drop their anxiety from this audio, or probably any relaxation technique, but definitely this audio. So the more anxious you are, the more likely you are to have a big, nice drop in pre-procedure anxiety. So ain't that nice? So my recommendation to Sam and everybody else is just schedule the sucker and do it and be done with it. And this will help you. So if you have any questions, comments, just add them below, and we'll probably post a link so you can see this thing that we're talking about. And it's really good for just things where even if you're only going to be half awake, you just dread the idea of it. This usually consists of colonoscopies, gynecological exams, dentist visits, things where they have to put a camera down your throat or your windpipe, just, things that you just think, ugh, I can't do that. I don't want to do that. Just listen to your tape and do it. And be done with it. Anyway, that's my advice. Good luck. Add your comments, questions, ideas, insights, and suggestions for other people, your experiences. Thanks. Bye.